Now, if we want to see what happens in a first world country when it loses control of an epidemic, you only have to look at New York City at the moment. Here is one of the most developed, sophisticated and desirable cities in the world that's had its health system overrun by the coronavirus. It's been through tough times in the past, of course, but it's really being tested in the here and now.
Our expression has been New York tough because every day is tough on many, many levels. I get it. But every day that we are New York tough, we are actually saving lives.
Mayor Andrew Cuomo admits he and many others underestimated this virus, but he says New York might have reached its peak in infections and deaths, but the human toll has been shocking.
We lost more lives yesterday than we have to date. I understand the data, but you're talking about 799 lives, the highest number ever.
Yeah, he went on in that interview to talk about how they were bringing additional funeral directors into New York to help them dispose of the bodies. The city literally can't deal with the death that this coronavirus pandemic is bringing to the great city of New York. Now, if you bring this back to our experience, we know this is exactly what we in Australia have worked so hard to avoid. The whole objective for more than 2 months now has been to slow the spread of the disease to such a level that we have the capacity in our health system, in our hospital system, to deal with everyone who gets sick. That's why we've banned overseas visitors, shut businesses and imposed physical distancing rules. And it's also why we've reorganised hospital facilities to boost critical care beds and create surge capacity. This is why it's hard to comprehend some of the alarmist reporting in our media, where we've had headlines about 150,000 deaths and the like. Have a look at what the ABC's Dr. Norman Swan told us less than 3 weeks ago.
So the predictions at the moment, if this hockey stick doesn't change that much, is that we'll be out of ICU beds in New South Wales. Victoria will be behind that by April 10th.
Well, here we are. It is April 10, and we have something north of 5,000 critical care beds available nationally and less than 100 seriously ill coronavirus patients. Talk about fear-mongering. Swan said we'd have more patients than beds right now. He also said we'd have 8,000 infections overall the weekend before last, and we've still got just above 6,000. In fact, have a listen to the Deputy Chief Medical Officer and where he says we are at today.
Ideally, where you want to be is below 1, so less than one other person being infected after a person themselves had the infection. And once you get to that point, the virus dies out or the epidemic dies out. And so at the moment, we're probably on the cusp of that in Australia.
It is very encouraging, isn't it? And those journalists and others who ran the alarmist lines and numbers, perhaps it's time for them to correct themselves, apologise for their hysterical claims, and given they were so critical of the government early on, they might want to give them some credit now. Don't hold your breath.